Hello, everyone. It's Dr. Scott Haggerty again with BE-ELITE.org, and we're here today to talk about the problem with wheat. So, wheat, wheat gluten, has become a hot button topic for many folks, but I find that there's a lot of confusion as to why or if you should become gluten free. So, what we are going to attempt to do today is we're going to try and go through some of the information, some of the big important reasons why you and your family should consider becoming gluten free. So, let's go ahead and dive in. So one of the big issues with grain is they are considered to be toxic to our body. When we say grain toxicity, what we're talking about is that grains have a number of different things that can become toxic within our system, causing problems with immune overactivity, changing the pH of the body, causing our body to not be able to absorb certain vitamins and minerals as well. So grains as a whole are almost entirely omega-6 fatty acids, and wheat in particular is 100% omega-6 fatty acids, no omega-3s. So if you're familiar with our Food as Medicine webinar, one of the things we established was there's an important ratio. 4 to 1. There has to be, for every one omega-3 fatty acid, there needs to be no greater than 4 omega-6s. When you start looking at the typical American diet, we are way out of balance. We're talking typically in the diet between 50 and 60 omega-6s to every one omega-3. And this leads to significant amounts of immune overactivity, or what we call low-grade chronic systemic inflammation. Grains also decrease the pH of our body as they are very, very acidic. pH regulation is important because becoming too acidic leads to a number of different health conditions, from skin issues to increasing risk factors for cancer. So it's very important that we keep a pretty tight rein on the acidity or alkalinity of our tissues. They're also extremely high in carbohydrates, so it causes issue with what they call glycemic regulation or blood sugar regulation. Um, you know, Carbohydrates are what they are. So when you eat wheat bread, wheat pasta, they're almost entirely carbohydrates. So they will have a relatively high impact on our blood sugar, making regulation of blood sugar more and more difficult as the years pass and the system becomes more injured due to long-term high amounts of carbohydrate intake. Gliadin and gluten. We're going to dig a little bit more into these here. But these are the two most significant concerns as far as a damage perspective, and why we should strongly consider reducing or eliminating our intake of these two compounds. There's another compound that's very common in grains such as wheat called phytates. And one of the big issues is that phytates bind calcium and magnesium and iron, so we can't absorb them. And it's a compound that's mainly found in grains, and it's also been shown to have issues with potentially decreasing the absorption of other minerals, including iron, calcium, zinc. So there's other issues that we want to deal with when we start talking about grain toxicity. So as we mentioned, there's the issues with balance, omega-6 to omega-3s, and long-term consumption of these omega-6 dominant foods will lead to low-grade systemic chronic inflammation. And this becomes a big issue because now you're talking about increased likelihood for things such as cardiovascular disease, increasing your likelihood of diabetes, predisposing you to certain types of cancers, gout, so increasing the rate, pace, and severity of arthritis. If you have rheumatoid arthritis, you'll have greater amounts of flares. If you're talking about just general systemic inflammation, you're going to be sick more often if your system is chronically inflamed because your body is becoming over time more autoimmune, less able to go and fight the battles it needs to for keeping you healthy for general maintenance purposes. So as we mentioned here with phytic acid, found mainly in grains, and may influence the availability of iron, calcium, zinc, and other elements. So gluten and gliadin. So celiac and gluten sensitivity are strongly linked to a number of conditions, and gluten and gliadin are the primary players. So gliadin is a component of gluten, okay, and gluten is a protein. It's the protein that's found inside of the wheat. When we have direct contact with the gluten and gliadin, if they're unbound, not assisted in digestion by their own native enzymes, then we have a predisposition, a propensity to develop certain types of issues, because these two proteins are very irritating to our nervous system and to our immune system. So we want to unpack a few of these and talk about what they potentially do. So there's been quite a bit of information linking gluten-gliadin problems or overconsumption to thyroiditis, psychiatric issues such as schizophrenia, many digestive disorders including celiac and digestive dysregulation, chronic fatigue syndrome, chronic migraines, depression, things such as ataxia, peripheral neuropathy, epilepsy, dementia, cerebral vasculitis, encephalitis. A lot of these concerns are one part overactivity of the immune system. Two, there's also this issue of gut inflammation that comes from long-term high grain intake. And what it does is it creates a condition that is oftentimes termed leaky gut syndrome. This leaky gut syndrome is known to be a small intestinal bacterial overgrowth issue. What happens is that the bacteria from the gut leaks over into areas of the body that it's not supposed to get to. And what happens is then the gut becomes porous. Instead of having a nice firm wall where compounds that should not pass through are not able to, proteins get through into the body that should not get there. And when they reach certain areas like the joints, they will lead to inflammation. Approximately 20% of all patients with irritable bowel disease, Crohn's and colitis, are also accompanied by joint inflammation. So we know that there is a lot of leaking in people who have Crohn's and colitis through their gut, and these proteins will go to distant sites such as the joints and cause substantial amounts of inflammation. So in a healthy gut, no more than 2% of the intact proteins pass through. In a leaky gut, you have a disrupted gut ecology, aka bacterial overgrowth. And this causes deficiencies in your host immune defense, which means you, the host, by increasing the permeability of the intestinal barrier. So the intestinal wall is supposed to be a pretty closed barrier, only allowing certain compounds through. If this barrier in any way is compromised, then chemicals that should not get through are able to go and pass to different parts of the body through the bloodstream. And if they're not supposed to be there, then they can cause harm, irritation, and eventually over time, potentially certain types of diseases. Lectins are what are called glycoproteins that are found in cereal, grains, and legumes, or your beans. They are also known to increase gut permeability and, again, bacterial overgrowth. One of the big issues with bacterial overgrowth is when bacteria grow, they secrete chemicals. These chemicals can be toxic to our system if our body is not adapted to handle it. The small intestine, if the bacteria that are native to the large intestine overgrow into the small intestine, then what will happen is the toxins that are secreted by the bacteria that are normal and native to the large intestine and don't cause harm there, if they get into the porous small intestine and then these chemicals go into the bloodstream, they become very damaging to our immune defenses. There's a strong link that's been shown between lectins and inflammatory bowel disease, joint inflammation, and damage to kidney function, because these proteins will travel and these chemicals will travel through the bloodstream, reaching the tissues and causing long-term harm when done many years on end. So what lectins do is they behave like antibodies in lab studies. Many of these lectins are resistant to cooking and digestion and are distributed to distant parts of the body after ingestion, as we talked about. They've been shown to cause diseases in man and animals, and they facilitate the growth of pathogenic bacteria such as E. coli. They are very pro-inflammatory to the immune system, and they actually have been considered as a trigger for rheumatoid arthritis. So gluten sensitivity akin to celiac disease. So gluten sensitivity is a condition with symptoms similar to those of celiac disease that improve when gluten is eliminated from the diet, but they do not show up on lab tests as positive for celiac disease. But many similar symptoms, such as a foggy mind, abdominal pain, bloating, depression, ADHD-like behavior, diarrhea, constipation, headaches, bone and joint pain, and chronic fatigue, when gluten is present on a regular basis in the diet. And again, as I mentioned, they may not test positive for celiac, but eliminating gluten from their system does relieve their symptoms. So this is a brief overview. I hope that this was enlightening and gives you a little bit of a better idea as to why you may want to consider removing gluten from your diet. There's some great books out there that you may want to consider, such as Wheat Belly. It is one of the more comprehensive texts on the damage that is being caused to your body by wheat gluten. So you may want to pick that one up at the store or on Amazon and take a look and read it. The more that you can become empowered by things such as webinars like this and books like Wheat Belly and other sources, the more you will be able to go and help yourself and help your family. So this is Dr. Scott Haggerty with BE-ELITE.org, and I hope this information was helpful. Please feel free to leave comments on the forum or on the Facebook page, and let me know what you think. Or if there's other things you'd like to talk about, please feel free to send me a message through our contact page, or leave a message on the forum, and if we see some things that are of interest, then we'll go ahead and create webinars to discuss these for you and help you along your journey to wellness. So this is Dr. Scott Haggerty signing off.